The crux of our program at the task force are our case management services. Every HIV-positive individual who connects with our agency is assigned to a case manager who is their liaison to the community. The case manager is the link to make sure that a client has a doctor, understands their treatment plan, helps them get benefits to pay for medications if they're prescribed to them, and connects them to all the other resources in the community that they may need, such as mental health counseling and substance abuse counseling, both of which are available to our clients right here at the task force. We do a lot of work around housing because we know that housing is an important part of health care, and without a safe and affordable place to live, our clients are unable to maintain their important medication regimens. We work with landlords, we help our clients find suitable apartments and help them apply for voucher programs if they need assistance in paying their rent. Additionally, we offer emergency rental and utility assistance ourselves. The agency also has a food pantry, and we have a registered dietitian that specializes in the needs of people living with HIV/AIDS. We have a peer resources network, which is a group of people living with HIV who have come together to share resources and help each other learn how to live better and more productive lives. At the task force, we make an effort to employ a holistic approach to caring for our clients. In a sense, we wrap our arms around their whole being and make sure that all of their needs are met. Just getting medical care isn't enough if you don't have a safe place to live. Getting mental health counseling isn't enough if you're still struggling with your drug addiction. So we try to offer non-judgmental, compassionate, client-centered support so that folks can get all of their needs met.
It was in my second year of college that I became very sick with something, and I wasn't quite sure what it was. At the time, the diagnosis was AIDS-related complex, and I was told that I was about 6.5 or 7 years post-infection, and that most people died in their 9th year. Without the help of the task force, I could never have sorted through and determined what services I needed at what time. With the task force, I was able to determine that I was ready to work more, and so got from some training through a referral to vocational rehabilitation. I tell you, without a doubt, were it not for the Southern New Hampshire HIV/AIDS Task Force, I could not possibly be here today. Thank you all for all that you've done to help keep me alive 21 years post-diagnosis after I had been told I had 2 years to live.
Despite significant medical advances in the treatment of HIV/AIDS in the last 15 to 20 years, AIDS service organizations like the Southern New Hampshire HIV/AIDS Task Force are an important resource in our community. We know that there are lots of folks living with HIV/AIDS in our community who are thriving and are doing well and are able to take care of themselves. The folks that we serve are those who have multiple barriers to getting their basic needs met as well as maintaining their health care. With multiple services located under one roof, we employ a holistic approach where all of our clients' needs can be met, if not at this one location, then someplace close by in the community. We are located in downtown Nashua. Our agency is right on the bus route for those who lack transportation. We serve folks living with HIV/AIDS in Southern New Hampshire, primarily Southern Hillsborough County. Anyone living with HIV in this community can contact us directly in order to receive services. They don't need to get a referral from a doctor or other provider in order to connect with us.